Yes, good evening, everyone. How are you? The time is 8 p.m. here in Lagos, Nigeria. How are you? And welcome to another session of Ask the Doctors. My name is Frederick Unwibohai, and I can always tell you, good life na sense. Now, if you're watching this program after we have ended, I'm sorry, we might not be able to respond to you because I noticed that whenever we come online and we are done with the live session, some people come, they watch, and they drop comments. We can't respond. So I'm very sorry in case you're watching this video and we have ended. But right now, I am live on Facebook and I'm live on YouTube. And today we are going to be talking about something very, very interesting. If you're a parent in the house, tonight's discussion would benefit you a lot. But before I continue, tell me, where are you watching me from? Everybody, quickly, good evening. I see you. We have a lot of people in the house already. Oh, yeah, tell me, where are you watching me from? Yes, TG. TG, I see you, TG. How you day? How you day? Good evening. Welcome. Who else again is watching me? Okay, now without wasting much time, my guest is already in the house, and I'm going to bring him up very, very soon. And I know you have a lot of questions. Don't worry, I will take your questions. We have Solomon from Port Harcourt. Precious is watching us from UK. Mabel from Lagos. Mabel, I see you. Ify from Ikorodu. Oh yeah, let's go. Let's go. I want to see your comment. Tell me, where are you watching me from? Oh yeah, let's go. Let's go. We have a lot of people in the house this evening. Okay, I'm watching from where? I'm watching from the United States. Okay, Minnesota. I'm watching from Anambra. I'm watching from South Sudan. Interesting. Okay, now we are talking about dispelling myths about children's health. And we have a guest with us tonight. Now, let me introduce my guest. Some of you might have seen him. If you're very active on Instagram, you might have seen him. My guest tonight, I have been wanting to bring him on this program for a very long time, but God said today is the day. So my guest is Dr. Ayodele Reina. He's a consultant pediatrician. He's also a digital health communication expert. He's a health blogger and a lifestyle influencer. Interesting. He has 7 years of experience in caring for children in both preventive and therapeutic settings. He infuses a healthy dose of comic relief. If you watch his videos on Instagram, you will see him dancing a lot. A senior doctor dancing. So if you are not dancing, man, you are a learner. And he adds charm in presenting free public health education, in making learning for parents fun and exciting. His online blog on Instagram is the Noisy Ninja Pediatrician. He volunteers for non-governmental organizations like Ask the Pediatrician, Luvia Health. His great passion and career focus is working towards ensuring that no Nigerian child dies from preventive causes. Ladies and gentlemen, for the very first time on Ask the Doctors program, it is indeed my great honor to welcome a multiple award-winning expert, consultant pediatrician, communications expert, Dr. Ayodele Reina. Good evening, sir.
Hey, Dr. Fred Books. Thank you so much for that very warm welcome. And, it's just such a pleasure to be here with you today, this evening.
Thank you so much. I know we are supposed to have this session a long time ago, but you've been very busy, like very,
Ah,
very busy.
it's been crazy, but we thank God that we don't look like what we are going through or been through.
Oh,
So,
sir, so
thank God.
there's this question I really wanted to ask you before we start. How did you come
Yes.
across about that name, the Noisy Ninja Pediatrician? How did it happen?
So it's very interesting. When I started creating content on Instagram, I was just Dr. Rena, I daily Rena or something. And then in going through Instagram, I realized that there was actually a lot of noise going on. People were doing skits, and I enjoyed them. But I found out that some of them didn't really have any end apart from entertainment. And entertainment is great, but I was like, well, A lot of people are making noise about things that matter to them. So why don't I make noise about things that matter to me? And so I said, you know what, the noisy Niger pediatrician. So that's how I started making the noise that was the important noise of us need to hear every now and again.
Okay, one more before I start asking you about parents and their kids. How has it been? I know you practice in Nigeria. What is it
Yes.
like practicing as a consultant, pediatrician, taking care of kids? What is it like making health educational videos free with your time and the little resources you have? How has it been for you?
It's been so in terms of practicing pediatrics in Nigeria, I would like to use very challenging. So I've had the privilege of practicing both in the private sector and the public sector. In the private sector, you know that is especially standard private settings, and I've worked in those settings as well. Things are a bit more standard. You can get things easily, request for investigations, and you get them. The patients are on managed care, like health insurance, and so they are covered for a
Mm,
lot of important investigations and treatments. But in the government setting, things are entirely different, and this is where you now see the stark and the harsh reality of how wildly variant
mm,
groups of people within the same locality can be. You see, the very poor people who can barely afford things, and sometimes you need some tests to be run or to be done to make sure that
yeah.
you get the patient better care, but they can't do it, and you can't take informed decisions. And so these are the challenges that one experiences in, practicing in the government setting. And so the good news is that majority of children will have relatively simple illnesses that will come and go without any issues. But for those ones that will have severe illnesses, those ones are important too. I mean, we need to save those ones. In the midst of all of this, I have told myself that it is important that we try to prevent those children who are ill from getting to the stage where they will need serious intervention. And so I keep on preaching the message of early
Yeah.
presentation whenever a parent feels that a child is ill, not just walking to go and pick up any drug in the pharmacy, no self-medication. So, and that is really what my blog, centers around. And I combine all of this. It's not easy to do, which is why if you notice my content is always very short form. I try to make it as
Yeah.
short form as
Yeah.
possible because I'm still teaching house officers and teaching other medical officers in my practice. I still need to learn new things and train myself. So this combining all of this with the content creation hasn't been easy, but I'm very grateful that the support I've gotten support from people like you, from my community, and so I really, just appreciate all of you.
Thank you so much. It's funny that we are both putting on blue tonight. I don't know how did it happen?
And I see that your blue has a good life in a sense, which is your slogan.
Yes, yes, yes,
Unfortunately,
yes.
I don't have a slogan yet. I'll probably come up with one soon. But I think
Yeah.
we are just operating on the same frequency. Maybe blue is the color for children.
Abio. Good evening, everybody. You're welcome. We are having a very wonderful conversation today, talking about kids, and we are breaking some myths. I want to start with this very popular one. Whenever we talk about it, parents and our people, they'll tell me that it has been happening in the olden days. Why do you want to come here and tell us what we've been doing before? And it has to do with convulsion. We know
Hmm.
convulsion can happen around across all age group, but it also happens in children. And there's something
Yes.
parents do. They put spoon in the mouth. Sometimes they burn the feet of the child. Sometimes they tell
Yes.
you to put onion and whatever. So I want you, sir, to help us address this tonight. When a child is convulsing, how should a parent respond?
Okay. You are very correct, Dr. Fred, that a convulsion, first of all, is a very terrifying thing for a parent to witness, especially if they've not witnessed a convulsion before. They literally think that the child is dying because that is how it
Mm,
appears. Because the
yeah.
child is stiff, child is rigid, child is shaking, eyes are turned up, child is unresponsive. And it has not really helped, that unfortunately in popular media and films, especially in Nigeria, once a person convulses like that, that's the end. The person usually ends up dying because maybe they've been poisoned or something. And so and
Mm,
in all fairness to people have actually heard of people who have, lost their lives, after a convulsion and all of that. So it's a terrifying thing, no doubt about it. But when it comes to a child having convulsion, the good news is that most convulsions will stop by themselves before 5 minutes of starting. So convulsion starts now in a child, even before 5 minutes, the convulsion usually stops by itself. And nothing you can do at home can stop the convulsion. Putting the feet inside the fire will not stop the convulsion. Putting onion inside the eye will not stop the convulsion. Crude oil, cow's urine, urine of an old woman, and these are things that I've actually seen people do. Pepper in the eye, pouring water on the child is not going to stop the convulsion. The only thing that can stop a convulsion is certain medications that should be administered in a proper healthcare setting, and the fact that the convulsion is going to stop by itself. That being said, if a child is having a convulsion, please make sure that they are as far away from anything that is dangerous. For instance, an open body of water like a swimming pool, any electricity or fire. Take them away from any danger. Lie them on their side so that if they vomit during the convulsion, then any vomit can come out of their mouths. Then make sure that they are not having any tight clothing on them, whether it is a belt, whether it is a cap, whether it is a tie, whatever it is, losing any tight clothing on them. Then please do not press them down. Pressing them down is not going to stop the convulsion, and it can actually even break some of their bones. Don't put a spoon into the mouth, because the risk of them biting their tongue and cutting their tongue off or swallowing their tongue is very, very minimal. Don't give them anything to drink like palm oil or agbo while they're having a convulsion. They can aspirate, meaning that the liquid is going to go into the wrong place, into their lungs, and it will be an even worse outcome. Take them to the nearest hospital, please. Some people actually like to take those children having convulsion to the hospital that has the child's card, and sometimes that hospital is kilometers away from where they are living. But simply because that's where they gave birth to the child, they want to take the child all the way 10 kilometers. Meanwhile, there is a hospital nearby. So, in other words, I'm saying every family should have a hospital as close to their house as possible for emergencies, so that you can take that child there, they can stabilize the child, and if you think that the child needs further care or evaluation, then you can now take to the hospital where the child was given birth to or circumcised, or where they have the child's card.
Thank you, sir. I want to ask, you mentioned there is nothing you can do at home that would stop it. Sometimes it could stop on its own. What should a parent do if the convulsion lasts for a certain period of time? I know that there are triggers of this convulsion most times
Yes.
for kids. What should a parent do so that this child does not get to that stage of having these seizures and the rest?
Okay. So when it comes to preventing, so of course there are various things that can cause convulsions. One of the commonest reasons why a child will have convulsion is if they have a fever, which we call a febrile convulsion. Now, with febrile convulsions, the child has a fever. Sometimes the temperature is rising, is on the rise, and then the child has a convulsion. Now, there's a tendency for febrile seizures to run through families, such that if you take a history, sometimes you hear that, oh, about 20%, you might hear that, oh, this Naso Papa Bio, that this child's father or this child's mother too used to have convulsions when they were small, when they had a
Mm,
temperature. Of course, it is not every child that has a temperature that will go on to have a convulsion. As a matter of fact, it is a minority of children who have fever that will end up having convulsions. Sometimes, and of course, it's when it comes to convulsions with fever, children who have convulsions, while they're having fever, they just have a natural tendency in their body system and in their brain to have
mm,
such convulsions. Now,
convulsions.
the the thinking used to be that, oh, if you can prevent the fever, or if you can bring down the temperature, then the child is less likely to
From being into
have the
the
convulsion.
convulsion.
Well,
Yeah.
we are come to realize that that isn't always the case. As a matter of fact, it is not the case in a lot of cases, which is why we're now trying to emphasize the idea that please don't do the wrong things when the child has a convulsion. Because
Mm,
sometimes when there's a febrile convulsion, even before the child actually has a temperature that you can detect on their skin, they have a
mhm.
convulsion. And then the fever will now come. So, meaning that sometimes the first sign that the child is having any kind of illness is the convulsion rather than the fever. What we are saying is that please don't say that you will not give paracetamol. Please give paracetamol to any child that has a fever, especially if the child is uncomfortable or if the temperature is
Mhm.
more than 38.5 degrees. Give them a paracetamol or ibuprofen to bring down the temperature at the right dose. Please make sure that the dose is correct for the child. But we are saying that please don't feel bad or don't feel that you have not done your duty if the child still ends up having a convulsion, because we have seen that in majority of cases, no matter what you do, any child who has a natural tendency to have a convulsion with a fever will have the convulsion no matter what you do, which is why you need to be equipped with the knowledge to know what not to do and what to do when the child has a convulsion. The time limit I always state is that if a child has a convulsion and it lasts more than 5 minutes, please move the child to the nearest hospital. That is the time frame we
Okay.
usually give to say, okay, please, if a convulsion has lasted for 5 minutes or more, move to the nearest hospital. If it has not lasted up to 5 minutes, we want you to still go to the nearest hospital in case the child has another one. Because sometimes there's a tendency that if a child has a convulsion now, they can have another convulsion within a short time after that. And in that situation, you want to be where the child can get care as soon as possible, rather than you being at home and being panicked. Yeah.
Thank you very much, sir. Before I go to the next question, I can see some comments in the comment section. Don't worry, I would come to your question. Joy or Yates, please just take note of your questions. And when we are done here, I will surely come to the comment section. But please, I beg, help me share this live session so that more parents, guardians, and future parents would also come here and learn. Now, sir, let's talk about the area of teaching. Teaching, very popular.
Very.
Doctor, the reason my baby is falling sick is because my baby is teaching. They say my baby is teaching. I have to give my baby teaching medicine. Please help us address this. Is it true that when a child is not coming out with the different teeth, the child will always fall sick? And if it does happen, how should this be handled?
Hmm. Today, sorry, Dr. Fred. I know we've addressed it, but I can see there's a question here about putting spoon inside the baby's mouth from Chinoye into Dim.
Okay, okay. It says, and please start putting spoon in the baby's mouth while convulsing. Is it the best thing to do? She's just coming. Oh yeah, respond again.
Just comment. It's not, oh, please. It's not. Please don't put spoon inside anybody's mouth. Don't put your finger inside anybody's mouth that is having a convulsion. They can bite that finger off. And so I've said that let me just reiterate that the best thing to do if a child is having a convulsion is that just lie the child down on their side, loosen all tight clothing, take them away from anything that is dangerous. The convulsion will usually stop by self before 5 minutes. If the convulsion continues for more than 5 minutes, take to the nearest hospital. If the convulsion stops before 5 minutes, still take to the nearest hospital in case the child has another convulsion after that.
Mm.
Teething. Teething, I think, is one of the most, the way people always say, accuse the devil and say, it's the devil that made me do it. Meanwhile, it's not the devil that made them do it. Oh. They did it
Mm,
with their own church mind.
yes.
But that's the same reputation that teaching has. They were accusing teaching of things that teaching did not do. So, teething is a natural process. Teething is a very natural process in which children begin to bring out their teeth or erupt teeth. Now, the main myth about teething is that teething causes fever, and
Mm-hmm.
nothing could be further from the truth. Teething does not cause fever. Take it to the bank. I repeat, teething does not cause a child to have temperature. Their bodies can feel hotter than usual, but if you take a measurement, that body temperature will never reach 38 degrees. Which is another thing that we do not do, I think, as a society here. We don't measure our children's temperatures. I know that, and I don't dispute a mother. The mother says that her child has a fever. I tell her, I agree with you. Your child has a fever. When I now begin to become a little bit, skeptical, and say, doctor, it's only the head that is hot. And I'll be like, okay, only the head. What about the body? The body feels normal. And in that situation, I would actually want the mom to tell me a temperature reading so that I know if truly there's a fever or if this is just the head getting warmer than usual. So
Mm.
when it comes to teething, teething is a process by which the teeth erupt. Usually it happens between 4 months and 6 months, but for some children it might not happen until 1 year. So as the teeth erupt, they can become sorry, they can become a little bit irritable. They'll be drooling saliva, rubbing their gums on a lot of things. They might refuse certain foods. They might refuse food. They might not eat as much as possible. They might poo a little bit more frequently because all that saliva that they are drooling is making their intestine to move faster. However, it doesn't give them temperature. It does not give them cough. It does not make them lose weight, and it does not give them watery poo poo. So what I found is that a lot of parents will just not go to the hospital because they assume that this child is having a high temperature because it is teething. Meanwhile, it is not the teething. It can be a viral infection. It can be a horrible bacterial infection. It can be an ear infection. It can be a urinary tract infection. But they will sit in the house, giving all sorts of teething mixtures, giving all sorts of ibuprofen. Meanwhile, the bacteria that is dealing with the child is getting free opportunity to do so because the mother and parents are assuming that it is teething that is causing the temperature, meaning that the chances that we could have had to start treatment for that child on time is lost because they are sitting down at home and they are giving teething powder, hoping that the temperature will go. Meanwhile, the teething powder doesn't really even take care of whatever is going on. The teething powder has certain things in it, apart from things that help to relieve temperature. It has things that make the child a little bit sleepy. And so you see a child that was irritable before. And the next thing, the child becomes calm, not really because the child is not uncomfortable anymore, but because the child is now drowsy because they've given teething powder that has things that make children and make anybody you give those kind of drugs to make them calm. And so the calm child, the mother is happy that the child is calmer, but the child is not a good calm because the child has been given a drug that is making the child sleepy and slow and sluggish.
Oh, thank you very much. If you are just coming, you are welcome. Please, if you have any comments and any questions, I beg you, just relax. We'll take your comments very, very soon. Now, like you heard what Dr. Reina said, a lot of parents just believe that as long as the child is having the teeth, there must be treatment. Okay, we have been told that you don't need to give that child anything, but sometimes it might just be that the child has maybe a viral infection. This is why I even want to ask something concerning infection, sir. I'm going to the area of infection because you mentioned it. Whenever a child develops a fever
Yes.
and the parents present that child to the hospital, I don't know if it's happened to you, but I have seen somewhere I was practicing before somewhere. If you don't put that child on antibiotic, they say you are not a good doctor. That for every fever, there must be antibiotics given to that child. Please, sir, is this how it's done?
Eh, it is not how it's done, though, Fred. I understand that kind of pressure because thank you. Because
Sorry, sir.
what happens is that a lot of parents they come to the hospital seeking care, and I commend them for it because some other parents they could have gone straight to the chemists to just go and pick up antibiotics. But these
Mhm.
ones they've come to the hospital, so they're expecting that the antibiotic will not get from the chemists. The doctor will be the one to give them official permission or official prescription to use the
Mhm.
antibiotics. However, it is not every child that has temperature that will need antibiotics. The way of deciding which child needs antibiotics and which child does not is based on a very wide range of the factors. One, the age of the child is very important. Any child less than 3 months that's having any temperature, 38 or above, we don't joke around with those ones because the immune system is so low that it can be a very severe infection. And at 3 months, the immune system is not really working perfectly well yet. And so for those ones, we even usually admit them to give them antibiotics as injection. From 3 months going up until 5 years, majority of them will have simple infections like cough and catarrh, viral infections. And so we will look at the child and look out for certain types of danger signs.
Mm,
So if the child is having a fever without something we call a focus, and when we say a focus, we are trying to determine where is this fever temperature coming from. So for instance, if a child is having cough and catarrh and is having a temperature, we most likely know that it's coming from the nose and throat, and somebody has given them, the common cold, which is most likely viral. If we see a child with temperature and they're having a pus coming out of the ear, we know that maybe it's an ear infection, and then we can give antibiotics for that kind of one. But if we see a child that only temperature, we don't know, child is not having watery poo poo, so it's not the tummy, it's not a tummy infection. Child is not having cough, so it's not a chest infection. So we're asking ourselves, where could this infection be coming from? Such children, after running tests, we are more likely to give those types of children antibiotics, and depending on their age, we're even likely to admit them. So it's a very complex decision-making process. However, what I would like to tell the mothers is that specifically when it comes to cough and catarrh, please, if a child is having cough and catarrh, it is unlikely or it is not every time that we will give them antibiotics. The decision to give antibiotics to short children should actually be left to your doctor so that you don't abuse antibiotics. Because eventually the risk is that when eventually you now need the antibiotics, the organisms would have developed resistance to that antibiotics. So please, if your doctor says that your child does not need antibiotics, please adhere. Usually we will give you what we call a safety net and say that, okay, ma, we're not giving you antibiotics, but if you notice any of the following: child not eating, temperature rising, child refusing all types of feeds, excessive vomiting, please bring back, or if it has lasted for more than a certain number of days, please bring back, and then we'll be happy to start antibiotics or admit you. People that live abroad, UK, US, help me to ask them how many times they have seen antibiotics. Well, it's here that we've just be giving them antibiotics. And I think even sometimes doctors too, they don't want the patients to come and disturb them, as you said, say that they are not competent. And so even though they know that the child does not need antibiotics, they will still prescribe so that this woman will just leave my head a big.
Hey. Yeah, so I've had that experience before. Good evening, Clara. I see you. Ben Juliet. Good evening. Ngozi Amina. I see you. Good evening. Welcome, everybody. I can see some questions. Don't worry. I have a few more, and then I will. Okay. Let me do this. Let me go. Let me go up. Let me take one question from somebody here. Let's see. Let me see. Let me take one question here. Okay. Nikki from Ghana is asking, what causes dull children, intelligent children? Why?
Well,
What happens?
wow, that's a deep one. No? Okay. So Nikki,
Nikki.
dull unintelligent. So dull is a very broad term. I imagine that dull unintelligent, not sharp academically. Hmm. We call this a learning disability or an intellectual disability, and a lot of things can cause intellectual disability. What I have come to realize is that when it comes to intellectual disability or a learning disability, there are a lot of things that are involved. Because to learn, a child must have their eyes intact, a child must have their ears intact. So they must be seeing
Mhm.
properly to learn about what's going on around them. They must be hearing properly to acquire speech, acquire language. So sometimes it's not always the fact that it's the child's brain that is a problem. It is the information reception organs like the eyes and ears that are not working. So are we taking that child for an eye screen? That child might not be seeing the blackboard. That child might not even be seeing you
Mm,
very well to
mm,
understand what it is that you're
mm,
doing. That child may not be hearing what is going on. That child may not be hearing, and you're thinking, why is this child so stubborn? Why is that? I must shout, 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 shout before that child is not hearing. Have you taken that child for a hearing screen? Before you now talk about, okay, is the brain processing the information properly? Once you have done the hearing screen and the eye screen and they are both fine, then we can now begin to look at the process of, okay, is it that maybe the brain is just really not interpreting the information properly? And it is possible for a child to have, a learning disability simply because the brain is not interpreting the information properly. And in that situation, we have to ask other extensive questions about things like nutrition, diet, pregnancy, whether there was any issue in pregnancy, in terms of like drugs you might have used, infections that you might have been exposed to, fever or health conditions that you might have had in pregnancy, family history of a similar kind of, intellectual disability, possibility of certain types of brain conditions. And we can even ask you about convulsions. We can ask you about, a family history of hyperactivity, or whether the child is hyperactive, because sometimes it's not like as if the child is not intelligent, but the child simply cannot just stay in one place to actually learn. And that's, what we call attention deficit hyperactivity disorder. And so all these things need to be taken into consideration. But generally, when we say a child that has a learning disability, the first thing that we normally do is send for hearing and sight assessment to make sure that truly this child is actually receiving the information around him properly, and then we can take it from there.
Thank you very much. Okay, Nikki, I hope you got your answer. Sir, you mentioned nutrition, you mentioned diets. I want to ask this. It's everywhere, and it's about multivitamins. The place of
Yes.
doctor, my baby is not eating. Which multivitamin should I give my baby? Um, I want to give my baby multivitamin all through. What is the recommendation in this case?
When it comes to multivitamins, the recommendation is that, as a general rule, a child who is having a healthy, balanced diet, and of course, we're going to discuss that. A healthy, balanced diet does not need multivitamin supplementation. And that is just the reality. In the first 6 months of life, we all know that what a child should be getting as a healthy, balanced diet is breast milk. Breast milk constitutes a healthy, full, complex, balanced diet for a child in the first 6 months of life. After the first 6 months, then you can now start adding complementary feeds. Now, complementary feeds are feeds that we use to complement, as the name says. We don't use it to replace breast milk. We add it on the breast milk. So meaning that you should actually still continue to breastfeed your child, according to WHO, till 2 years and beyond. But
Mm,
in that first 1 year of life, breast milk really should still be the major source of nutrition for the child. It's just that by 6 months, you want to begin to introduce the child to semi-solids and other types of solid food to make up for the gaps that the breast milk cannot meet. And these gaps include the iron needs for the child. So you are thinking about introducing foods that are rich in iron, and then the iodine needs for that child, because iodine is very important in brain development and making sure that the child is actually thriving very well.
mm,
Now, some people routinely want to give babies multivitamins from day one. As a matter of fact, when we discharge some babies without any multivitamin, and there's a very popular brand, I'm not going to call the name, the
mm.
grandmas usually are like, your doctor didn't ask you to take any drugs, didn't ask you to give this baby any drugs. You're sure it's a doctor? You're sure it's a doctor that took this your baby? You're sure it's a doctor? You're sure you delivered in a hospital? Of course, because they expect that the doctor should always give a newborn infant this multivitamin, but we all know that that is not necessary. Now, in what situations can a child be given multivitamin supplements? Now, a child can be given multivitamin supplements if, one, they are picky eaters.
Mhm.
And this is something that we all deal with. And we all have different ways of dealing with picky eaters. In the local setting, they will beat that picky eating out of you. Because either they beat it out of you, you will stop picking, you eat, or they force me, and which is something that we always
Boss.
discourage. That
Yeah.
force feeding children is a very wrong practice. It's a dangerous practice that we have seen children die from time and time again. So, picky eaters might need to get multivitamins because they're not getting enough of certain types of nutrients, because they're not eating this or they're not eating that. Does multivitamins increase appetite? Because, as you said, that's one of the reasons why parents actually want you to give them multivitamins, because they say
Yes,
that
yes.
vitamin B specifically used to make children's appetite increase. Well, the reality is that there is no evidence that multivitamin supplements increases appetite. There is some evidence that if a child lacks certain multivitamins or vitamins, yes, they will lose appetite. But usually the loss of appetite is not the only thing that the child will present with. The
Present,
child will
yeah.
present with weight loss. The child will present with certain types of other features like nails falling off, change certain color changes of the skin. So for a child to lack multivitamin to the extent that they are losing appetite, man, the child will not be running and playing around the way the mother is. Because I come into the office and say, ah, this child is not eating. I'm like, okay, let me see the child. Child's weight is good. Child has a good height. Is running up and down, active, playing. So in my mind, what the mother is trying to say is that this child is not eating as much as I want them to eat.
So it, yes, yes, yes.
The child is eating enough to sustain that child for their own needs. So what I always encourage parents to do is that please make sure that you are following the WHO recommendation for what we call a minimum dietary diversity. Minimum dietary diversity is a situation where you are providing the child with the minimum required nutrients for the child's optimal growth. And what we're talking about is things like carbohydrates, proteins, healthy fats, fruits, and vegetables. A child greater than 1 year of age every day should get fruits, should get vegetables, should get protein, should get a healthy amount of carbohydrates, including breastfeeding if you're breastfeeding until the child is 2 years old. So please pay attention to that thing. You can go and check it. World Health Organization minimum dietary diversity for children, and you'll see what that is. It's very important.
Sir, did you say a child greater than 1 year should eat fruits?
Yes. As a matter of fact, a child less than 1 year should actually even eat fruits and vegetables, of course, presented to them in a very, very palatable and safe way, in a safe way. So, is in terms of the number of servings. So, what I was trying to say was that greater than 1 year, every day they should get what we call 5 servings of fruits and vegetables, and there are specific serving sizes for those children. So it's a bit more complex than what we can discuss in this session. So they should have
Yeah.
5 servings of fruits and vegetables in a day.
The reason why I had to stress that again is because for the past 3 years, I have been doing something, at least one fruit a day, fruit challenge
The fruit challenge,
daily.
yes, yes. I do the fruit challenge.
Yes, yes. And some people online now decided to give me money. So anybody who does well, who participates, will give out prize to the winners. And we've had a lot of people just to encourage our people to eat fruits because people are not eating fruits.
They are not, oh,
They are
they
not.
are not. Hmm. My brother, there was one day I
Because
was coming back from work. I stopped over, I bought fruits, and because I park some distance from my house, in the daytime, so I can move the car in later. I was carrying a bag of fruits, and one of the women that's in the area that knows me that sells stuff, she's not like, ah, doctor, I'm going to come and meet you for this fruit. So while it seemed like a very funny comment, in my mind, it said to me that she know they buy fruits. She doesn't buy fruits to eat like that because I mean I bought the whole watermelon and the whole watermelon was 3.5. Okay. So and you think about it, somebody that has not finished buying rice, that's not finished buying waiting go belle food there, that's not finished buying fish, we should now go and start buying fruits. So fruits for a lot of people seem a luxury. They just feel like, "Ah, I never chop finish. Now
mm,
fruits I go come dey chop." So if they are not eating fruits, how much more their children? So they're not buying fruits for themselves. They are definitely not buying fruits for their children.
yeah, that's true. Okay, let's take some comments. Before I take your comment, I beg now. Make I use pidgin English. I beg. Share this live session. Abi, in no they give value. We have a consultant in the house tonight. I beg. Share this video. Thank you. Okay, sir, we have a comment from Uzochi. She says, why will a baby reject the mother's breast, not sucking? Asking for someone.
Ah, man, that's a very important question because some babies will actually refuse to refuse to they might suck it initially and then refuse. Sometimes they will not even take it at all. There are a lot of reasons, possible reasons. And I think, first of all, please see a lactation consultant. If the person has access to a lactation consultant, and there are a few of them on Instagram and online. So, Um, when it comes to them refusing breast milk, one, it can be the fact that the breast milk supply is too low for the child, and so the child is getting frustrated. Sometimes the breast milk might have an unusual taste because I've seen some mothers, that because they had some kind of condition like mastitis, the mother actually had to express her breast milk, and when she tasted it, it was bitter, bitter. But the milk in the other breast was fine, and so the child was actually taken from the other breast well, but wasn't taken from the breast in which the breast milk was considered to be bitter. Then it could also be the fact that there is a poor latch, and so maybe the nipple is inverted, nipple is flat, even though that might not really cause difficulty with feeding for all babies. For some babies, they might reject it because they are not just able to latch on very well. And for some babies, we just will never know. And so what we always say is that for the mom, don't get frustrated. Please try to express your breast milk and then feed with a cup and spoon, or feed with a with caution with a feeding bottle. Of course, with a feeding bottle, there are a lot of other things like the possibility of contamination of the feeding bottle. So you must pay meticulous attention to this proper sterilization technique for the bottles. Okay, making sure that you are sterilizing it properly so that you don't introduce infection to the child. So these are the options. We always like formula to be the last resort. Still try to keep on feeding. If you have to start formula, please start it in conjunction with advice from your physician or your doctor or your lactation consultant or whoever it is. But please see a doctor, see a lactation consultant, and they'll be able to help as to why this might be happening.
Okay, let's take one more comment from Blessed. Blessed, I saw your stars. Thank you. I'm in UK, doctor. My two kids are too active and has learning disabilities. In fact, at 5, they are not having spoken words. They can only say hi, come, or bye. Please, what can cause this? And we don't have such disorder in our family.
Hmm. Okay. Wow. I'm really sorry to hear this. This must be very difficult for you, especially in the fact that you are not living in Nigeria. I won't lie to you, it can be quite challenging, especially when you are surrounded by a different culture. Here, you have people that will understand with you, and at least will offer you some kind of comfort. But in the UK, it can be a tough life. But that being said, again, this session is really not to diagnose or treat anyone, but I'll just offer suggestions. But please still go and see your physician. Yeah, somebody already pointed it out. Peace is saying autism, and I totally agree. So people on the autism spectrum have difficulty with language. They have difficulty with social interaction, and then they also can have associated conditions like attention deficit hyperactivity disorder. And yes, I agree with you. This it might not happen in your family, it might not be common in your family, but sometimes these things appear out of nowhere. And you say it's your two sons, so I imagine that they are twins, and these things are commoner when these are commoner in siblings, especially identical twins. So if they're identical twins, even if they're not identical, if they share the same womb environments, I mean, they are what they are predisposed to is close enough. You might be asking what could have caused this. Nobody knows what causes any of these things. Nobody knows what causes any of these things. So they are going to have to be seen by, of course, a pediatric neurologist, a pediatric behavioral specialist, clinical psychologist, and have special education that is tailored towards their very specific needs. Please hang in there. I know it's not easy. The reality is that sometimes for these children, they will just wake up and you find out that all the words that you think that they were not acquiring, they will just start to pour everything out. And I know that sometimes some others testify to the fact that sometimes those children they say certain things that the mothers had no idea that they knew that this assuming this person has been hearing all the things that I've been saying, and I certainly hope that that will be your case as well, and that eventually they'll be able to function properly. Well done.
Yeah, I'm so sorry, Blessed. Madam Clara, thank you for the stars. Thank you. God bless you. The people sending stars and sharing, thank you so much. Okay, before I come back to your questions, let me just take one quickly. This place of hiccup, sir, babies and hiccup, it's been giving some parents concern and fear. My baby hiccup. Oh, they say I should tie some a rope on the baby's head. I should tie this. So how would the parents help that child that has a hiccup?
Hiccups. Hiccups are very common in babies. And for a mother, if they do one hiccup, a mother can ignore that one. But see, when hiccups start, they can do 10 hiccups, 50 hiccups. They will just be, where. A hiccup is a normal phenomenon. It's a normal thing in which there's a certain muscle that is in our between our chest and our tummy that is contracting. And when it contracts, it sucks in some air. So hiccups are normal. They don't harm the child. The child doesn't find them painful. The child doesn't find them uncomfortable. The hiccups are more uncomfortable to us as parents, to us as caregivers, than it is to the baby. And so we think the baby is uncomfortable, and so we don't want to make the baby, we want the baby to come out of that discomfort. And so we want to give extra breast milk or we give water. Meanwhile, that's not what is going to stop the hiccups. So, or we put thread on the hair so that the hiccups will stop. And some mothers have argued with me on my page and said, Dr. Rena, we can agree with you on anything, no. But this thread on the head stopping hiccup, we are not going to agree for you, Dr. Rena. We are going to fight you to the last because it stops hiccup, but it's not true. The hiccup was going to stop by itself. The hiccup was going to stop by itself. So what's the treatment for hiccup? Do absolutely nothing. Don't give extra breast milk. Don't give any water. Don't put thread on the head because those hiccups will go when they are ready to go.
There we go. When they are ready to go. I am late. Oh, Evie Gloria, you came late. Echo Bet, you came late. So this program is every Sunday, 8 p.m. 8 p.m. Nigerian time to 9 p.m. And we've been doing this program for the past 4 years. Don't forget, every Sunday, 8 p.m., we are always here. So before I forget, I beg, in case anybody wants to reach out to you, how can they reach out to you? So that's
Okay.
let's not forget this. Yes.
So the place in which I can easily be reached is the Noisy Niger Pediatrician on Instagram. And my Linktree link is actually there. And you can send me a message in my inbox, or you can join my mom's community that I run with Agnosis Care on Demand. And once you join that community, then we answer your questions.
Okay. Let's take some questions. We are not seeing your questions, oh. Send your questions. Questions are much here. Oh. And remember, I'm streaming on 3 platforms. I'm streaming on Facebook, 2 Facebook pages, and YouTube. So maybe you are dropping your questions somewhere. I can't see them. So please, quickly send them again. And thank you for all the stars. Let's see. Okay, let's take this. I'm going up. Okay, just to confirm if this is true, giving a child from birth with honey, does that make the child brighter in terms of intelligence? Honey.
No, it's not true. It's not. It doesn't. Honey has nothing to do with intelligence. Intelligence is a more of a factor of what a child is exposed to. So a child, um, a child is can be a child is more likely to be intelligent when a child is allowed to be intelligent. If that makes any sense. So talk to the child all the time. Challenge the child with things that help the child to solve problems. Challenge the child with problem solving skills. Nutrition is very important, and honey is not involved. No, as far as anybody knows, honey is not part of the things that helps the child to be more intelligent. Breast milk is very helpful. Breast milk actually is. They found out that children who are breastfed usually score better on IQ tests than children who are on formula. However, again, IQ tests are a relatively subjective test of intelligence. That's not to say that children who are formula fed are not intelligent. No. What we're saying is that when we try to measure as much as we can, children who are exclusively breastfed actually score better on IQ tests. Regardless of that, even children who are formula fed for any reason or the other are very, very intelligent. So nutrition is very important. A nurturing environment. Now, the brain does not like to deal with trauma. If a brain is traumatized, that brain will use all its capacity to survive the trauma rather than learn. What do I mean by trauma? Things like neglect, things like fear,
Mm-hmm.
excessive beating, excessive punishments, Now, I know people say that, but Dr. Rena, maybe they flogged us very well. Maybe they flogged you too, and you are very, maybe I might have been more intelligent than I am now. They did not flog me. Maybe. Because now, a part of my brain is now still thinking that, somebody's going to come and flog me. Somebody's going to come and flog me. And the fact of the matter is that a lot of us, even though we are no longer children, especially if we were flogged, we're always thinking that there's somebody waiting somewhere to flog us. Behind somewhere in our mind, we always, hey, is anybody coming to punish me for something that I did not do? So we carry that trauma with us, and so we don't really have time to be creative. We're always looking for who is about to punish us. So please create a nurturing environment for your child whereby they're allowed to make mistakes, they're encouraged to ask questions and give them sincere answers.
Okay, we are almost running out of time. Let's take this comment from Chidi. Please, doctor, what causes sepsis in a baby and the prevention?
Sepsis in babies, very important, is a very, very dangerous condition. And sepsis is when a child has a severe infection that enters the bloodstream. And when a child has sepsis, it can be caused by bacteria, which is a type of organism. It can be caused by viruses. It can be caused by fungi. It can be caused by occasionally parasites. But bacterial sepsis is the one that is the worst. Okay, sepsis caused by bacteria, and usually those bacteria get into the child's system either through the nose and throat, which is the respiratory tract. Sometimes it gets into their system through the urinary tract, through the urine. Sometimes it gets into their system through the ears. Can also get into their system through their tummies. But the commonest is usually the respiratory tract when somebody coughs or sneezes on them and they have that bacteria in their nose or throat. Now, in terms of prevention, breastfeeding very important in preventing bacterial sepsis. Immunization very important. Please take all your vaccines. It can prevent sepsis, especially from certain types of organisms that we call streptococcus. Then please make sure that any ill adult should stay as far away from the child as possible. Any adult who is having, funny symptoms, cough, catarrh, fever, if they must come near the child, they should always wear a face mask so that they don't transmit these infections to the baby. Caregivers must always wash their hands. Please, I cannot, because what I see is that some people, they'll just pick their nose, and next thing they're going to go and prepare food for the baby. They're going to go and carry the baby without washing their hands. And that's your finger that has gone into your nose. That your nose might have dangerous organisms that have built estates inside your nose and they are living comfortably, but they have an organization, they have an arrangement with you, and so they are not affecting you. But for a person who has low immune system, like a baby, it will cause problems for that baby. Hand washing, hand washing, hand washing. So some people, they go into the toilets, they clean up, they think that there's no poo on their hand, but there's poo on their hand. And so they go and prepare food for children, or they wash the hand, but they don't use soap. So please, they must always wash your hands with soap and water, especially if you are caring for children. Wash your hands with soap and running water. It's very, very, very important. These are not all the causes, but these are the commonest causes and the commonest ways of preventing sepsis in children.
Okay, we are almost out of time. Saying, please, is honey good for a baby less than a year? And also, please talk about measles, if I got the spelling right.
Okay,
I
measles.
notice you can.
Okay,
Okay.
measles.
Yeah.
Yes. Okay, honey is not good for baby less than 1 year at all, at all, at all, at all. We always say avoid giving honey to a child that is less than 1 year because there's a certain type of contaminants, they call it botulinum toxin, and it can potentially contaminate honey. We're not saying that every honey has botulinum toxin, but we're saying that that botulinum toxin is the same Botox that they normally inject into people's face to make the face free of wrinkle, because it causes the muscle to be paralyzed. And so imagine that if that toxin gets into a baby's system and the muscles are paralyzed like that, the baby will not breathe and the baby can actually die from that. So we always say, please avoid giving honey to a child less than 1 year. After 1 year, their stomach acid is now strong enough to neutralize the toxin. So no honey for children below the 1 year. Then measles. What was the question going on about measles? Okay. Also talk about measles. Okay, so
Yeah.
measles is a viral infection. Measles is an infection that causes a rash. But the thing about what people don't know about measles is that measles does not only cause a rash. Oh. A rash is just one of the manifestations of measles. Maybe it's the manifestation of measles that makes it most easily recognizable. But measles is dangerous because it can cause eye problems, can cause conjunctivitis, it can cause blindness because it injures the a part of the eye that we normally use to see, this front part of the eye. It can cause pneumonia. Measles can actually also cause brain infection. It can cause meningitis. So measles is not to be joked around with, which is why I always say, please, 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 please make sure that your child is immunized for measles. The rash of measles always starts from the head and then goes down, spreads downwards. And when it's going away too, it starts to go away from the head as it spreads downwards. Now, a child is protected from measles if you or the mother, you've gotten your MMR vaccine. The child is protected from measles, and by getting your own MMR vaccine, you are going to pass what we call antibodies to your baby, such that before the baby reaches the day or the year when the baby is supposed to get his own vaccine, your own antibodies will be protecting the child from getting measles. Also, again, to prevent measles, we have to talk about hand hygiene, cough etiquette, making sure that people are coughing into their elbows and not into the atmosphere, you know. So, me, a lot of mothers, once they just see any rash, they just say, ah, this is definitely measles. And so they begin to rub calamine lotion and other things. But if you see a child that has a fever and a rash, I think God beg you, please go to the hospital. Let us make a specific diagnosis because it could be other rashes like rubella, it could be other rashes like roseola, it could be other rashes like chicken pox. Not every rash with a fever is measles, and it's important for us to make a diagnosis of the rash because for some rashes, the child can go to school within a few days of the rash appearing. For some other types of rashes, the child must stay away from school for a longer time. Okay, so please make sure that you go to the hospital and that you have the rash diagnosed, especially if the rash is all over the body and the child has a fever.
Thank you very, very much. We are close to ending, but I would not forgive myself if I don't bring this up. Last week, talking about World Immunization Week. I think we are still
Yes.
in there, round up. So I just wanted to please emphasize again. I think you mentioned it when talking about measles, the importance of vaccines. You know, since the whole COVID, some parents have been now averse to vaccines. I'm not going to give my child vaccines. Could you help us reemphasize the importance, the benefits of vaccinations?
Please, I cannot even overemphasize it because vaccines are so important and they are life saving. Smallpox was eradicated because of vaccines. Polio is almost eradicated in the whole world because of vaccines. Vaccines have helped children in the West have fewer cases of meningitis, fewer cases of all sorts of horrible infections that we are still dealing with here every single day. So, I cannot emphasize it enough that vaccines are safe, they are effective, they prevent infections, they save lives, they do not cause autism. Okay, people always say, oh, vaccines they cause autism. Vaccines do not cause autism. And this is something that has been proven time and time again. I know that there is a lot of distrust with the healthcare system, especially given the unprofessional and unscrupulous practices that some pharmaceutical companies have engaged in the past. But the one that they normally cite was not about a vaccine, it was actually even
Mm,
about an antibiotic. It was an antibiotic that they were giving, and the antibiotic, instead of giving the children the right dose, they were giving those children a lower dose, of a particular antibiotic so that it will look like as if their own antibiotic was working better than the other antibiotic. But everybody just said that, oh, once the Oyibo people are bringing anything, then it's going to be harmful to us, which is where I think all of us as a community, as a society, need to become alert to the fact that maybe we should actually begin to develop vaccines, develop and manufacture vaccines here in this part of the world, so that at least let's not be like, okay, even if it is not Weibo people making it, okay, at least now we they make them. So maybe if you now know sabi say we dey make am, then maybe una go collect am. But this is something that a lot of funding has gone into, in terms of research, in terms of, because if we had to pay what we're supposed to be paying for these vaccines, a lot of us will not actually be able to get these vaccines because they are really, really, really expensive. But donor organizations have come together to make sure that the federal government has come to make sure that these vaccines are available and that they are available to us at a very, very subsidized rate. And this is important because the children are important. We don't want
Mm-hmm.
children to develop disabilities because of infections. We don't want children who could have become great musicians, pediatricians, who could have, formed a medical movement that is educating the entire nation, like good life in a sense. We want those children to become these people. But if these infections are killing them before that time, then we are losing so much potential as a nation to be greater because of these children. And so what we say is that please immunize your child today. Today.
Mm. Sir, any final words?
So first of all, let me thank you very much, Dr. Fred, for having me on this show, Good Life in a Sense show. It's such a pleasure being here. It's always a pleasure to, interact with you and talk with you. And for everyone that has asked questions and that have contributed, thank you so much. I know that the challenges of parenting and motherhood especially are not easy, and I'm very grateful that you guys have actually shared some of your experiences about being abroad and the challenges that you've experienced. I don't take it for granted because it really is challenging, and for you to share it with us is very wonderful. Thank you. So what I'd say is that so please follow me on Instagram at the Noisy Niger Pediatrician. Um, Children, I'm not sure that any parents or any mother particularly, if you ask them this question, what is the most important thing to you in their life? Sorry, the husbands, oh, what's the most precious thing to you in your life? For most of them, it's actually the child. It's actually the child. And so that is how the whole nation should view children. Children are the most precious thing, are the most precious things that we have in this nation. And safeguarding their health involves us spreading the right information, making sure that people do the right things for them. And so any way in which you can actually get the right information out by sharing the right content from qualified healthcare professionals about what you should be doing to help your child be happier and healthier, please do so, and we'll be better for it as a nation. Thank you.
Thank you. Thank you very, very much. I am sincerely very, very grateful. I don't know if I was to fill a form and come and meet your team and say, I need you on the program, if they would have allowed me to get you here. Thank you very much, sir. Ladies and gentlemen, you just listened to Dr. Ayodele Reina. He's a consultant pediatrician. He practices here in Nigeria. He's a multiple award-winning medical doctor, health influencer, lifestyle blogger, and his goal is to ensure that no Nigerian child dies from preventable diseases. I'm grateful that he was on this program, and I'm hoping that some other time, later in the future, we'll surely have him again. Thank you, sir, and God bless your pockets and increase
Amen.
your community.
Amen. Thank
Thank you
you
so much,
so
sir.
much,
Take care
Dr.
and have a
Fred.
wonderful.
Thank you, everyone.
Bye-bye. Ladies and gentlemen, not too much. You're too much. Everybody that sent me stars, God bless you. I saw the stars. Clara, Mr. Is it Blessed, Ngozi Amina? Thank you so, so much. You too much. Every Sunday when we come here, I always meet you on this program. Now, Una, they encourage me to come on the program, and I'm saying a very big thank you. Don't forget, our fruit challenge comes up next month. I'm saying this so that you get the information. I don't want anybody to do something that you don't understand. Please, if you don't understand the fruit challenge, don't join. Get the full information, I beg, so that you benefit. It's not about the money. It's not about the price. If you know, say you don't understand, no, do read the details, I beg. Next month, I want to see everybody participate in the fruit challenge. And at the end of the challenge, you might be lucky. We pick you as the winner. I want to say thank you to all my sponsors. And if you want to sponsor me on the fruit challenge, you know what to do. Send me an email. I still need sponsors. Remember, good life now waiting. Tell me, good life now waiting. Oh, let's go. Good life, good life, good life now waiting. Good life. Good life. Na sense. Ah, then Sabiam. You Sabiam, you Sabiam, you Sabiam, you Sabiam. Good life na sense. Blessed, no be money. Good life na sense. Take care and have a wonderful night. Bye-bye.